All right, today we're diving into a really critical but often invisible battle, the fight against infection. We're going to uncover the playbook that pathogens use to spread and, way more importantly, how we can break that chain and stop them in their tracks.
You know, this is a silent war, and it's being fought all around us, every single second. In hospitals, in our homes, everywhere. The enemy? These microscopic pathogens that are just constantly looking for a way in. And victory here isn't won with big weapons, but with strategy, with knowledge, and with discipline.
So what's our defense plan? Well, it's called infection prevention. Think of it like a strategic rulebook, a whole set of actions with one single mission to stop infections before they can even start. It's all about protecting patients, healthcare workers, and really, all of us.
Now, to beat any opponent, you have to know their playbook, right? Well, for a pathogen, that playbook is called the chain of infection. It's the exact step-by-step sequence of events it needs to spread. Our job is to learn those plays so we can totally break them up.
And the key thing to remember here is that it's a sequence. It's just like a line of dominoes. If you can just remove a single one, the whole chain reaction just stops.
So here it is, the 6-step playbook. It all starts with the infectious agent. That's the germ itself. That germ lives somewhere in what we call a reservoir. It needs a way out, the portal of exit, maybe like a cough. Then it travels through a mode of transmission. It gets in through a portal of entry. And finally, it finds a susceptible host. Our mission is to break just one of these 6 links. If we do that, the infection stops cold.
So that's it. That's the core of infection prevention, taking targeted actions to snap one of those links. So how do we actually do it? Well, we use 2 main levels of defense.
Think of it like this. First, you have your standard precautions. These are the universal rules, the things you do with every single patient, every single time. No exceptions. But when we're facing a really specific or dangerous threat, we have to call in the special ops, transmission-based precautions. Let's start with that foundation, okay? These are the absolute non-negotiables. This is the universal toolkit that forms our first and, honestly, our most critical line of defense.
This toolkit is designed to target the most common weak spots in the chain. Think about it. Hand hygiene stops transmission. Personal protective equipment, or PPE, gloves, masks, that blocks the entry and exit points. Safely handling materials gets rid of the reservoir. These are the simple, everyday habits that literally save lives.
But of all of these tools, there is one undisputed champion, and it's hand hygiene. Just washing your hands properly is recognized as the single most effective way to prevent infections. It's so fast, it's simple, and it's just incredibly powerful.
Okay, but what happens when we're dealing with a pathogen that has a really unique and dangerous way of traveling? That's when the standard procedure just isn't enough. That's when we have to deploy some specialized tactics.
These precautions zero right in on that 4th link in the chain we talked about, the mode of transmission. So we figure out exactly how a specific germ travels, and then we build a custom defense to stop it dead in its tracks.
And here are the 3 main special ops plans. For germs that spread by touch, like the resistant bacteria MRSA, we use contact precautions. For viruses that travel in big droplets from a cough, like the flu, we use droplet precautions. And for those really contagious pathogens that can just hang in the air, like measles or TB, we escalate to the highest level, airborne precautions.
And the tools have to match the threat. This is so important. For those bigger droplets, a standard surgical mask does the job. But for those tiny airborne particles, you need the much better filtration of an N95 respirator, and often a specialized room that actually contains the air itself. It's all about using the right tool for the job.
So we've got the strategies, but how do we actually put them into action on the front lines? And maybe, just as important, how do we know if we're actually winning this war?
Well, it all comes down to a daily checklist. Every single action on this list, from hand hygiene to isolating a patient, is a deliberate move to break that chain. This is where the theory becomes life-saving practice.
You know, even with the best defenses, you have to be vigilant. Professionals are constantly monitoring for those telltale signs of infection, things like a fever, swelling, or changes in lab results like a high white blood cell count. Catching it early is everything.
And of course, success is measured with data. Our healthcare-associated infections, we call them HAIs, are those numbers going down? Are staff actually using their PPE correctly? Do patients get what their role is? These numbers are what tell us if the strategy is actually working. Because ultimately, this isn't just about following a bunch of rules.
It's about creating a collective mindset, a real culture of safety where every single person understands their part in protecting themselves and everyone else.
Because in the end, the most powerful tool we have isn't a mask or a glove. It's knowledge. It's understanding this simple chain and knowing that you have the power to break it, whether you work in a hospital or you're just trying to avoid the flu this winter. So the real question is, now that you have the playbook, how are you going to use it?